Dr. Gilbere.
Good morning.
You are, yes, good morning. You are a doctor of naturopathy.
Yes.
I wonder if you could explain to us exactly what that means and how that fits into the scope of what we call medicine.
Well, in the scope of medicine or alternative medicine or complementary or integrative,
There you go.
all of those are terms used, and they basically mean that the difference is if you're talking about a naturopathic physician, for instance, a naturopathic physician is trained in a medical setting, meaning that they do maybe 6 years, depending on the program, where they actually have the same training as a physician, and then they go into some of the natural alternatives, meaning homeopathy and herbs and detoxification, etc., lifestyle changes and nutrition. Where a traditional naturopath, which is what I am, is not allowed to do anything invasive. We don't prescribe drugs. Naturopathic physicians may prescribe certain drugs. They can do minor surgery, invasive procedures such as IVs, pelvic exams, etc. We cannot. So basically a traditional naturopath is one that is trained in lifestyle changes, detoxification, rejuvenation of the body by natural methods, meaning all non-drug methods. It's a pluralistic medicine, meaning any modality that works that's natural, but first do no harm.
Okay.
When you're talking about a naturopathic physician, then physician is your key word there. And I believe that there's some new degrees there that are NMDs, meaning naturopathic medical doctors, right?
That's something a lot of people are trying to work towards.
Exactly, and that's great because we need integrative physicians of that scope. However, keep in mind that because of our healthcare system, which is in sad shape, these physicians are still not going to be able, in our current medical system, to be able to bill for an hour and a half, for instance, of time, which is what I do as a traditional naturopath, to be able to talk to you about environmental issues and when did your allergy start and autoimmune disorders and what might have contributed to it. We go into, you fill out 11 pages to become a patient of mine.
Isn't that interesting?
And it takes an hour and a half to get through it, and many times that's not even enough time because you really have to become, as you know, many of my patients coined me the health detective and the health architect, and I wish I could find a word that says detective and architect together. But what that means is that as a detective, we really have to get through and really pile through all of the clues, just like a detective would have to. When did this start? What changes were there in your lifestyle? What happened that might have triggered this? It might have put you over the edge. And then, as an architect, you really need to be able to provide that patient with the tools, with that blueprint. They don't know how to do the blueprint, but they can start building because you're giving them the tools to start rebuilding their health and to be able to not just deal with symptom care as in a conventional medical setting, because then that symptom care nowadays is becoming drug management in most cases. You have a symptom, we'll give you a pill for the symptom, we'll give you this for that, we'll do another test. You have a side effect to that, we'll give you something else. Naturopathy doesn't deal with that. We deal with root causes of your disorder.
Well, I think that's very interesting. I'd like to pursue this further with you. In another talk, maybe we can separate the difference on why somebody might seek out someone like yourself as opposed to not only a medical doctor, but maybe an MD, ND.
Okay.
Thank you very much.
You're very welcome.